So, hello everyone. Today we will be discussing about the ultraviolet radiation. Starting with the introduction, ultraviolet radiation (UVR) covers a small part of electromagnetic spectrum lying between the violet and of the visible light and X-ray region. UVR are invisible to the human eyes. The natural source of UVR is sun. UVR provoke chemical changes and not simply heat at sites where they are absorbed. Here, as you can see, the frequency, the site of wavelength, and the wavelength of radio waves, microwaves, infrared rays, visible rays, ultraviolet rays, X-rays, and gamma rays. The radiation introduced to the tissues through first the subcutaneous tissue, second the hair follicles, then third are the sebaceous gland. Here as you can see in the figure, there's a subcutaneous tissue, there's the hair follicles, and here are the sebaceous gland. The physical behavior of ultraviolet radiation. First, reflection. Second, refraction. Third, absorption. Fourth, penetration. Types of UVR. UVR are of four types. UVA, long ultraviolet, it is up to 400 to 350 nanometers. It penetrates to dermis, responsible for development of slow natural tan. UVB is a medium ultraviolet, erythemal ultraviolet radiation. It lasts up to 315 to 280 nanometers. It produces new pigment formation, sunburn, vitamin D synthesis, and responsible for inducing the skin cancer. Next up, it's the UVC. It is a short ultraviolet, germicidal ultraviolet. It is up to 280 to 100 nanometer. It does not reach the surface of the earth. Here, as you can see in the figure, sorry, yeah, as you can see, the depth of penetration. Production of ultraviolet radiation. The therapeutic UVR are produced by mercury vapor lamp, which consists of quartz burner tube, evacuated from air and containing of argon gas with a low pressure and mercury. An electrode is inserted at each end of the burner's tube. The current is applied to the electrodes, the mercury vapor, and the passage of electrons through the vapor establishes the UVR. As you can see, the quartz burner tube, which has a mercury metal cap, the initial ionizing voltage, the two AC mains, an electrode. It produces the UVR. The UVR apparatus. First, the air-cooled lamps. Hanuvia Alpine Sun Lamp. It's a high-pressure vapor lamp. The wavelength of 253 nanometer. It has a short wavelength used in the treatment of generalized skin condition as acne, vulgaris, and psoriasis. It emits ultraviolet, infrared, and visible light. UVR produce falls within the UVB range. Mainly used to produce erythema and accompanying photochemical reaction. The tridiamide formation. The heat produced inside the burner of quartz tube causes some of it to change to another form of silica that called as tridiamide. Tridiamide is an opaque to UVR, so output of the rays tends to fall. A variable resistance is included in the burner circuit to increase the potential difference across the burner and intensity of the current. Ozone formation. The photochemical action of UVR shorter than 250 nanometer in wavelength on atmospheric oxygen is to form ozone. Ozone is a toxic gas for inhalation and partly prevented by good ventilation. The level of ozone can be detected by smell. Next up, the water-cooled lamps. The chromium lamp wavelength at 366 nanometer give both UVA and UVB. Used for treating localized lesion as pressure areas, ulcers, sinuses in open areas. It is a water-cooled mercury vapor lamp. It eliminates the danger of an IRR burn. The distilled water is circulated in the jacket, the purpose of which is to absorb the IRR. After the use of the lamp, the water circulation should be continued for 5 minutes after the burner is switched off in order to cool the lamp. Tap water has a disadvantage that it contains salts and other impurities which may deposit in the quartz window. As you can see, chromium lamp. Care of mercury vapor lamp. First, it must be kept dry. It should not be turned on and off more frequently. Third, after 1,000 hours of use, the burner must be renewed. Fourth, the burner of an air-cooled lamp should be cleaned regularly with an absolute alcohol. Fifth, the burner should not be touched with fingers. After every 8 hours of use, the distilled water should be renewed. The advantage and disadvantages of mercury vapor lamp. First, it is used for the general UV irradiation. Second, the spectrum contains a large proportion of short UVR which are undesirable for the general treatment. Third is the fluorescent tubes. The modern treatment method often require the use of long ultraviolet without the short ultraviolet. So to meet these criteria, the fluorescent tubes are used. These are similar to the tubes used for the lightning. Each tube is about 120 centimeters long. It is made up of type of glass which allows long UV to pass. The output proportion of this is mainly of long UV, few IRR and some short ultraviolet. It is mainly used for the general irradiation for individuals or in the group. As you can see, the fluorescent tubes, which produces the UVR. Next up, the Theracetine tunnel. The Theracetine lamp consists of number of fluorescent tubes, each within a parabolic reflector incorporated into a semicircular tunnel. The wavelength between 290 to 350 nanometer UVA long, used in treating of affecting large areas. This provides an even irradiation to the patients. It allows treatment to the whole body in two halves. Two IRR elements are included in order to keep the patient warm during the treatment. All of the lamps should be positioned at least 18 degrees from the patient. As you can see, the Theracetine tunnel, which contains many amounts of fluorescent tubes. The penetration of ultraviolet rays, UVA at the dermis level, UVB up to the deep epidermis. Here are the physiological effects of UVR. Its local effects which produce locally in the area. It's erythema, pigmentation, tanning, thickening of epidermis, desquamation, peeling, Antibiotic effect. General effects are the result from a widespread irritation. First, vitamin D production. Second, the esophylactic effect. Third, the general tonic effect. Fourth is the immunosuppressive effect. The local effect of UVR is erythema. It is reddening of the skin, first observable effect of ultraviolet irradiation. It causes chemical action which result in irritation and destruction of the cells. This causes liberation of H substance which produce the triple response. The erythema is regarded as an inflammatory reaction stimulated by the ultraviolet radiations. Next up, the pigmentation or tanning. It is thought that the UVR stimulates melanocyte and accelerate the production of melanin pigment. Pigmentation commonly follows an erythemal reaction. It varies with the dosage of UVR and the different individuals. Next up, the thickening of epidermis. UVR provokes an increased reproduction of keratinocytes. This leads to thickening of epidermis, which acts as a protection against the rays. So longer doses are required to repeat an erythemal reaction. Here you can see the epidermal thickening. Fourth is the desquamation or peeling. It is the casting off of the dead cells from the surface of the skin. The desquamation is proportional to the intensity of the edema. The peeling results in reduction, loss of the increased resistance to the rays. The next up is the antibiotic effect. The destructive effect of the ultraviolet radiation include the destruction of viruses, bacteria, and other small organisms on the skin surface, such as fungi, commonly found in the wounds. The effect of ultraviolet P radiation. The general effects of ultraviolet rays. Vitamin D production. In the presence of UVB, convert 7-dehydrocholesterol into vitamin D through the chemical reaction. Vitamin D is required to assist in the absorption of calcium and phosphorus from the intestine to the bloodstream. The esophylactic effect. General UVA irradiation stimulates the reticular endothelial system, leads to ingestion of bacteria and produce antibodies against the bacteria and toxins. So the resistance of the body to infection is increased, and this being is known as the esophylactic effect. The general toning effect. It is being claimed that because of the general UV irradiation has a general tonic effect. Appetite and sleep being improved, nervousness and irritability decreased. Next up is the immunosuppressive effect. UVB destroys Langerhans cells, the macrophages. UVB stimulates proliferation of suppressor T cells of the lymphocytes. These effects produced by the prevention of autoimmune attacks on the skin cells. Test dose and determining medium minimal erythemal dose. It is used to assess the individual patient's the erythemal reaction to UVR irradiation. The basis for any calculation of any UVR dosage is the medium minimal erythemal dose. That stands MED. This MED refers to the response of erythema for the dose to be given. The patient must be understand that the purpose of MED test is to determine just how much exposure time is necessary based on their skin sensitivity. The proper patient education should be given. We wear goggles, observe and monitor the skin condition, keep skin moisture, follows exposure to the ultraviolet rays. Pigmentation changes are to be expected and are a normal response. The prolonged and repeated exposure lead to premature aging. Steps to determine test done or skin test. The air-cooled lamp. A suitable area of skin is selected for the test dose. It should be clear of skin disease. The flexor surface of the forearm is the most usual site. Other sites are abdomen, medial aspect of the arm or thigh. The selected site should be cleaned with soap and water to remove surface grease. It covers the patient other areas, leaving only the forearm exposed to the UVR. Use piece of length paper cardboard for irradiation of UVR along with a slide cover to pull up to reveal one opening at a time. 3 to 5 holes are cut. Middle hole should be 2 centimeter per square and 1 centimeter apart. The hole on one side larger and the other smaller. Here are the test dose. The minimal dose MED is the length of the UVR exposure required to produce a mild erythema which appears within 6 to 8 hours and still just visible after 24 hours. This cutting is fixed to the forearm with adhesive plasters. The cuttings are of different sizes and shape in order to make identification of erythema easier for the patient. We allow the lamp to warm up according to the manufacturer instructions. Place the lamp perpendicular to the area being tested and a distance of 50 to 90 centimeters from the site. Expose the first opening for 30 seconds, then expose the second opening for another 30 seconds and go on till the last opening. So the first opening would receive the longest exposure time and the last opening would receive the least amount of exposure time. Switch off the lamp. Instruct the patient to monitor the forearm every 2 hours and note which opening or shape appeared pink, red first, and when it is faded or disappeared. The patient is also given a card similar to the opening to make a note. Even those appear last and disappeared first. It is the least visible response. Therapeutic tunnel test procedure is similar, but larger holes are usually used up to 4 centimeters. It is placed on the abdomen. A chromium lamp is direct contact with the skin. Very small holes are used up to 0.25 centimeters. It needs a very short time. At the test applied, the minimal erythemal dose, it is slight reddening erythema on the skin which takes from 6 to 8 hours to develop and which still visible to 24 hours. As in degrees of erythema, E1, latent period in hours is 6 to 8 hours. Appearance of the color is mild pink. Duration of erythema lasts longer than 24 hours. Skin edema, there's none. Skin discomfort, none. Desquamation of the skin is none. Relation to E1 dose is in E2, latent period 4 to 6 hours. Appearance is definite pink or red. Duration of erythema up to 2 days. Skin edema none. Skin discomfort slight soreness. Desquamation of skin powdery. Relation to even dose 2.5% of the even. In E3, the latent period is 2 to 4 hours. Appearance of color is dark red. Duration of erythema 3 to 5 days. Skin edema at some. Skin discomfort hot and painful. Desquamation of skin in the sheets. And relation to even dose is 5% of the even. E4 is less than 2 latent period. Appearance color angry red. Duration of erythema a week. Skin edema causes blister. Skin discomfort is very painful. The estimation of the skin is thick sheets. 10% of the even. The dosage. Skin response to UVR depends upon the quantity of UVR energy applied to the skin, output of the lamp, nature of radiation and intensity. So to use the same machine throughout the course. B is the distance between the lamp and the skin. It depends upon inverse square law. Relation between distance and intensity. The angle at which radiation fall on the skin, it depends on cause and law effect. D is the time application. It depends upon the distance and on the sensitivities. Second is the biological responsiveness of the skin, the sensitivity of the skin in relation to even dose skin edema. Skin type, type 1, description is always burn. Type 2, never tan, always burn. Type 3, tan slightly, sometimes burn. Type 4, always a tan but never burns. Type 5 is always tan pigmented skin. And type 6 is the monoglyoid, heavily pigmented skin or negroid. Next is the circulation of dose. E1 upon the MED is the basic of UV calculation, which is determined for each individual patient by performing a skin test. From the point, all other doses of UVR can be calculated. E0 less than E1. E1 test dose is the minimal rhythmal dose, minimal perceptible dose. E2 is 2.5 into the E1. E3 is a 5 into of E1. E4 is to 10 into of the E1. E4 and double E4 are used on the open models. The progression of dosage and exposure to UVR should not be repeated until the erythema caused by a previous dose has faded. The thickening of epidermis makes it necessary to increase the exposure in order to repeat the erythemal reaction to each successive dose. To repeat an E1, 25% of the preceding dose is added. To repeat, an E2 of 55% of the dose preceding is added. To repeat an E3, 75% of the preceding dose is added. The frequency of UVR treatment and subarrhythmal dose may be given daily. E1 upon MED may be given alternate days, and E2 should be given twice a week, and E3 should be given 2 weeks apart, and E4 only very local areas, not frequently given. When treating non-skin areas such as pressure areas or ulcers, all doses may be given daily as there is no erythemal reaction produced. The calculation of new dose is to irradiate a smaller area. The source is more nearer to the patient, but the time of exposure must be altered to maintain the same intensity in accordance with the law of inverse squares. The new time is the old time into the new distance and the old distance. Therapeutic effects of the UVR. First, psoriasis. It is a skin condition which presents localized thick, pink, red plaques, sharply demarcated and covered with a silvery scale. In the state, the aim of UVR irradiation is to decrease the DNA synthesis in the cells of the skin and to improve the skin condition. Next up is the acne vulgaris. Acne is also a skin condition which presents pustules, papules formed by blocking of sebaceous pores and hair follicles, affecting mainly the face, chest, and back. The more severe and long-lasting forms cause disfiguring and serious distress. Using ultraviolet rays is aiming to produce desquamation to open the blocked pores and hair follicles. E2 dose is given to the face, chest, and the neck. Here's an eczema. It is an inflammatory response in the skin associated with the edema. The patient suffers marked itching with redness, calling, vesicles, and exudation of the serum on the skin. A mild UVR treatment will help the subacute and the chronic stage. The chronic infection and infected wound. Infected wounds such as ulcers, pressure sores, surgical incisions are often treated with high doses of UVR. The aim of UVR irradiation is to destroy the surface bacteria, remove the slaw, promote repair. The E3 dose is sufficient. The doses may be given daily and is not being applied to the normal skin. Fifth is the vitiligo. It is a condition in which destruction of melanocytes in local areas causes white patches to appear on the skin. Both UVA and UVB stimulate melanocyte activity. UVA seems to provoke a darker and longer lasting tanning. UVB provokes more thickening. Six is the non-infected wounds. The aim of UVR is to stimulate the growth of granulations, tissue, and speed up repair. The UVA stimulates the growth. Example for non-infected wounds are venous or arterial ulcers. 7. The incipient pressure areas. UVR may be used to prevent pressures areas from breaking down and stimulate the growth of epithelial cells and to destroy the surface bacteria. Even those progress daily using the Cromier's lamp. In areas such as the heels or the elbows where the skin is thicker, an E2 may be used. 8 is the counter irritation. It is used to produce a stronger counter irritation effect over the site of deep-seated pain. E4 dose is given to cause discomfort and producing a mask of pain. 9 is the protection for hypersensitive skin. Polymorphic light eruption is the commonest of photodermatomatosis. The increased tolerance to sunlight can be achieved by a course of UVB. Start with a very low dose and gradually progress. Next, the vitamin D deficiency. Vitamin D3 is formed in skin by the action of UVB and C on the 7-dehydrocholesterol. The natural sunlight can be curative or vitamin D deficiency disease. 11th is the pruritus, the intractable and serious itching that can occur due to raised bile acid level in the biliary cirrhosis or uremia, can successfully treated by suberythmal whole body UVB either alone or in combination with the drug cholestyramine. The contraindications of UVR are the pulmonary tuberculosis. Second is the severe cardiac disturbances. 3 is the SLE, which is systemic lupus erythematosus. 4th is the severe diabetes. 5th is the dermatological conditions is known as photosensitivity. Next up is the photosensitizing medication, the deep X-ray therapy, acute febrile illness, or the recent skin graft. Here's the dangers of UVR. First is the electrical shock. Eyes, UVR may produce conjunctivitis, iritis, or cataract. Third is the overdosage. UVR burn can occur mainly at the E4 reaction. Ozone, important to ensure the adequate ventilation in the area. Sensitization and sensitizing drugs. A number of drugs, some foods, and few patients are known to sensitize patient to the effect of UVR. The commonly seen in sensitizing groups are psoralenes, sensitizers, sulfonamides, antibiotic, phenothiazine, tranquilizer, barbiturates. As a filter is a substance which absorbs some rays and allows some rays to penetrate. Several filters are used to absorb a specific radiation which are emitted along with the UVR. Some filters are window glass, which absorb UVR below 275 nm. 2. Water absorb IRR and allows UVR to pass through it. 3 is a shower Skokjes glass absorb UVR and is used for making protective goggles. 4th is the blue violet glass and cellophane absorb UVR below 250 nm. 5th is the nickel glass foods filters. Chance UV glass are glasses which transmit only UVR. The liquid paraffin and cod liver oil, these are sometimes used instead of blue violet glass. It absorbs UVC. Using different filters make us use of different design use range of UV to produce an ineffective treatment. This is all it about the UVR. Thank you.